everyone, it's Dr. Ann Zink here, and I was asked to provide just a brief update and excitement for you all at the Emergency Management Conference. Congratulations for being here, and thank you for all that you have done. Emergency management has been in the front light and the spotlight through this year, and you guys are oftentimes kind of those secret workers behind the scene making things happen, but man, you are on the forefront. So as we move into this next year, I just really wanted to stop and pause and thank you for the work that you have done. You have put yourself and your life at risk to be able to care for others. You have figured out totally new ways to care for your community as well as your patients, and you continue to pivot and change. I'm really excited to see what the next couple years look like for emergency management services with all that you have done in the past and all that we can do together in the future. And so I encourage you to think broadly about all the possibilities moving forward. Continue to talk to your chiefs and to us about what your thoughts are. Let's find a way to really make healthcare better. Let's find a way to not make systems, people work for systems, but really find a way for systems to work for those people that you serve every day, day in and day out. And the last thing I just wanted to say is make sure that you take time for you. This has been a really challenging year. I think of the kind of, it's almost like these dents to your soul every time that you see a patient struggling with something that you know is preventable, or see someone angry about the mitigation efforts that you're trying to do to keep them safe and healthy. And I think as clinicians and as frontline providers, it's important that we always feel that we're always able to cry and express the frustration and the hurt and the pain of what we see, as well as the joy of our successes. But it's also important that we take time for ourselves and realize that kind of moral injury that I think so many of us have been through this year, that we have time to recognize it, that we have time to talk about it, and that we have time to support each other through it. This has just been an incredible year in so many ways. If there's anything I can ever do, please have a low threshold to reach out. And today, through the rest of your conference, I would love to challenge each of you to reach out to one of your coworkers, someone that you work with, and tell them a time where they helped you out. I think in so many ways, we help each other out in ways that we don't even know that we did. I'll send mine out to, let's see here, Gene Weissman. He now works for the state. Worked with him for years within Matsu initially while he was there. And he approached us during this pandemic and said, I want to help. I don't want to sit on the sidelines. I want to be a part of the solution. And he came and joined us at the team at DHSS, and it's been great to have him here. So thanks to you, Gene. And so now it's your turn to pass it forward and thank someone else on your team that has been helping you, because we are all a part of it. And make sure you take time for yourselves. So have a great conference, and I hope to really see you all in person and not just here on computer.
There's been a lot of work on the outbreak response, trying to create better coordination. Again, thank you all for so much of your help with this, setting up everything from alternative care sites to vaccination centers. You know, we've used some of the alternative care sites for places like infusion for monoclonal antibodies, and then for vaccination centers. And that work there was important. I think we've learned a lot and talked a lot about what does healthcare really mean in this state and in this country? What does surge capacity mean? How can we make sure that we can move patients as easily as possible from places? And how can we, again, work collectively together, not to just better the system, but to better people, to really better their individual health and well-being. I think another big learning point has been the data visualization. In healthcare itself, we've talked a lot about shared decision-making and making sure that patients have the tools that they need to be empowered to make the decisions for their health. But I think public health has been a little bit behind in that realm, where we've had the data and we share bits of it. But I think COVID has challenged us, and I'm really proud of the team's growth in data visualization, so people can see what's out there and make decisions for themselves, their businesses, for their community. These are just a few of the dashboards that are out there. There's more dashboards, it seems like, coming all the time. The vaccine monitoring dashboard is changing quite a bit, so you can see community to community how well we're doing with vaccination, so that we can encourage each other to all get vaccinated. We don't want anyone to be that red lantern of the vaccine team here. We want everyone to get across that finish line as quickly as possible and not pull in last. So doing what we can to encourage communities to increase their vaccine rates. You can also see the case data, the hospitalization, the modeling. Again, our goal has been transparent, timely, accurate data, so communities and individuals can make the decisions that make sense for themselves and their family. And so this is where we're at. We've got a lot of data, a lot of information, and I think we're at a time of pivoting now that we're able to get everyone 16 and above vaccinated. I do suspect that we'll start to be able to vaccinate those 12 to 16 here shortly. That's been applied to the FDA. I'm looking forward to that. There was a setback yesterday with J&J currently being held There have been 6 cases of a very rare type of blood clot that may be associated with the Johnson & Johnson vaccine. And out of a total abundance of caution, the CDC asked to hold any further distribution of J&J and administration of the J&J vaccine until they can look at the data a bit better. And so we do this in other examples. If we have some sort of safety signal or concern, we pause and we learn more before we move forward. So I'm grateful that we've paused. And right now the ACIP is meeting and reviewing that data overall to look at the safety data. Again, vaccines are about the safest thing we do in medicine, and we want to make sure it's incredibly safe and are being very transparent about what's happening. So we'll continue to follow that closely and making sure that we're following and sharing with Alaskans. We don't have any known cases of this rare type of blood clot in Alaska associated with the J&J vaccine in our VAERS reporting system, but we'll continue to monitor it and making sure that healthcare providers are educated about it. But I think it's important to, again, put this in context. We've had almost 70 million doses of the J&J vaccinated and have been administered. And so far, there's been 6 cases of this identified overall. So we'll continue to follow that and move forward. So here are the vaccines that are out there now. Again, the Moderna and the Pfizer, these are these mRNA-based ones. Again, they're just a small little bit of mRNA that's destroyed within your body, honestly, within a few hours of injection, surrounded by a fat particle, and then suspended in some salts and sugars. That's all that's in there. There's no other preservatives. There's no cells. There's no nanobots. There's no DNA. It doesn't enter your DNA. It doesn't change your DNA. It doesn't affect your fertility as far as we know. There's no reason mechanically that it would change your fertility at all. There's been many people who have gotten pregnant, and now we're seeing many people who have delivered after these vaccines. And again, they all seem to be completely safe and efficacious. The big risk that we see with the Pfizer and the Moderna is a small percentage of people can have what's called an anaphylactic reaction, kind of a large allergic reaction associated with it. And then a decent number of people will develop soreness in the arm, high fever, not feeling well. And again, that's the body's normal immune response to the vaccine itself. We always learn as we move forward. So whenever we have a vaccine rollout, you'll see many of the big safety signals early on in those trials. But when you really are looking for those very rare events, like we may be seeing with the Johnson & Johnson, it takes millions of doses to see those. And so that's why we really want to monitor very closely in those first couple months. The way vaccines work is there's no mechanism for kind of long-term side effects. I hear that a lot. The way that your immune system responds is really in those first 2 months in the response that happens there. And so that's why the data and the trials really set up for that kind of initial monitoring response. And they go on afterwards and continue to monitor. But when people ask, like, well, how can you be sure there's no long-term side effects? I can never be 100% sure about anything, and there's always risk benefit. But the way the immune system works and the way that these vaccines work, they're just in your body again for a couple hours. They're destroyed quickly, and your body responds to this kind of spike protein and makes the immune response quite quickly. We're not seeing any significant safety signals. So COVID must be authorized. The FDA is the most aggressive body and the hardest one to get through worldwide for authorization. There were no steps skipped in the process. There was just a lot of bureaucracy cut. So instead of having to fundraise between each trial, instead of the FDA approving and going through it and then the ACIP reviewing it, both got to see the primary literature at the same time and review it. So there were some things that were done in sequence. Again, there were animal studies that were done. There were all the normal safety steps that were done. So there's a lot of misinformation about there, and happy to take any questions about that. So again, cutting red tape and administrative bureaucracy, not cutting corners on safety. And again, happy to talk more about that. I find this graph, it's kind of similar to Michigan. Michigan's having a real surge in cases right now. And what you see in the Michigan data is in that less than 20 all the way to that 50 age group, they've had a real increase in hospitalizations because they're having a real surge right now. We're not having the same sort of surge, so we're not seeing an increase in hospitalizations. But what you do see here is this is our data looking back kind of December to current, and you're looking at the change in hospitalizations compared to vaccine rate. So the vaccine rate is the orange line there. And so you can see those 60 and above, we're getting, over 60% vaccinated versus less than 20, we're quite low, less than 10% vaccinated. And what we see is that the more we have a population vaccinated, the greater the decrease in hospitalizations. So while in Michigan, you see the greater hospitalizations in the younger group, here we see the greater decrease in hospitalizations in the older group. Both of these graphs are showing the same thing. And that is that vaccinations help prevent hospitalization. They help prevent severe and mild illness. And the biggest thing is they help prevent death associated with COVID-19 across all age groups. So we see this state to state, but this is Alaska specific data where you see this real plummeting of hospitalizations in the 60 plus with really high vaccine coverage. You can also see this in some of our gender and race ethnicity data as well. The other great thing is that, again, there's a lot more they can do. I'm actually, again, working from a remote computer right now because I saw my parents and I haven't seen them for 18 months. And man, it felt great. I was in tears thinking how great vaccines are because it really helps to protect me from them and them from me. And we're both fully vaccinated. And that's really what you can do post-vaccine fairly safely is, gather in private small settings without masks, without distancing, big old hugs with other vaccinated people. And as well being kind of in an inside area with other people who are low risk, like my kids who can't be vaccinated yet. CDC also made some changes to travel, including not needing to quarantine or test related to travel. Again, anytime we are around other people, there's always a risk, and vaccines aren't 100% perfect. So, I made a decision to test prior to travel, although CDC does not, say that you have to. Just again, was one additional tool that I chose to take before seeing my parents. But this makes a big difference for being able to reconnect and really get back to our life kind of prior to this. The big things that we just need to wait on are gathering these kind of large or medium-sized gatherings or gathering with other high-risk people that aren't vaccinated yet. That's just because not everyone's had a chance to get vaccinated. So we're really excited to have more people to be vaccinated. I do think that people's natural infection will provide some additional protection. But again, remember that vaccines provide better protection in general than the natural infection itself. Natural infection is a little bit like a choose your own adventure, and your body may respond very well and to a good response, or it may not, versus the vaccines are really designed to have a good, long-lasting immune response overall. The other thing that will really depend on how this all goes and what we end up doing is variants and seeing what happens with the variant cases nationwide and worldwide. You can see our variant cases. We do a sequencing report. We're sequencing somewhere between 20 to 40% of our positives right now. We can't sequence all of our cases, so things that were done on an antigen test per se or an Abbott now, we can't sequence those. But the PCR ones we do try to sequence. I will tell you, vaccinated people have lower viral loads, and so it's much harder to sequence those cases. But we do have some cases of vaccinated people that we have been able to sequence overall. We're seeing a real increase nationwide on this B117 variant, and that's the UK variant. The big thing about that one is it looks like it moves more easily from person to person, and it can cause a little bit more severe illness. The things I also worry about are like the P1 variant that can cause more rates of reinfection. So people who had previously been infected, as well as younger people, can get quite sick from the P1 variant. That's the Brazilian variant that we saw quite a bit. And the B1351 is the South African variant. And that one, the concern on that one is it's not quite the same strength of protection from the vaccines. But I will tell you that all three vaccines look like they work decently, if not very well, against all of these variants. No vaccine does not work at all against any of these variants. And so the biggest thing we can do to help slow these variants down is to get vaccinated and not waiting to see, if a new vaccine is coming out, but getting vaccinated now. We are really impacted by how we all individually do and how we do collectively. We really want to keep a lid on COVID because I don't know about you all. I'm done with COVID. Sometimes I'm kind of surprised when people are like, I haven't really got around to getting vaccinated. I'm like, have you been enjoying this pandemic? I, for one, am done. And I would love it if you all could get vaccinated so we can all be done and talk about something else. So I'm really excited to put COVID. This is not fun for any of us. And I think the sooner we all get there and the sooner we put this lid on this and put it in a box and put it away, the better we all are. And that is just by getting vaccinated. So let's just all get vaccinated and see our family and put this behind us. And let's talk about other great ways to build healthcare within Alaska and partnering and emergency response. We got a lot of other things to do. There's a lot of other spaces there, but we need everyone to step into the space so we can put this behind us. And unfortunately, we're not quite there yet. So those cases are sneaky and they keep kind of creeping up right now. There's a lot of people hanging out and doing a lot of stuff, and it's resulting in more cases, particularly, less than half of the eligible population vaccinated. Or I can look at the glass half full. We have almost half of the eligible population partially vaccinated. So we're truly at that glass half full, half empty moment at the moment. But I am amazed at how effective and how safe these vaccines are and would love to do it. So where do we go from here? I think how we responded to this pandemic has been really important, but how we recover out of it is going to be as important as how we responded. And that's really connecting with you all, these community connections. I really, truly believe in what ways can we build systems to serve patients instead of patients serving systems? What ways can we really make this about the individual Alaskans' health and well-being? And so kind of here are a few takeaways that just continue to resonate to me. One is communication, and partnership is key and led by communities. And you guys probably know that better than anyone else in the state, in your partnership with communities and leading with partners to be able to create healthy and well-being. I see many familiar names on here, have been able to just be honored to learn from you all throughout the year, but that partnership is really what you all have done so well, and really appreciate that. The next thing for communication is real-time transparent data and data visualization to allow for meaningful action. It's been great to see many of your websites and what that has looked like in your partnership with mayors and leaders to be able to move forward. But I think having that visualization has been a really important tool for many of our communities being able to move forward. I do think a two-way dialogue really increases trust and strengthens response. I learn things every day from people sending me emails, from the conversations like this, and hearing from you all about what's working and what that's not working. Our public science echo, our health echoes, what ways we have these two-way conversations. Fairbanks has their ongoing provider call on Tuesday nights. Juneau's doing a bunch, Search has been doing a bunch. Like many of you are doing this on a regular basis, but what ways we can build this into our response moving forward. Building data systems for better response, so convenient and low to no cost testing outside of traditional healthcare was key. And that isn't a part of other work that we do. So what ways can we make sure that Alaskans have the tools that they need to care for the health of themselves and their community, and potentially outside of traditional healthcare systems to be able to make sure that we're able to respond quickly and together? Uniform reporting metrics and bidirectional information. It's one thing to make a lot of reports on this end, but that doesn't really do anything if it doesn't actionable on the other end. And that's kind of on that third point of report as well. Reporting that's meaningful and actionable. We joke sometimes in public health that I really have no desire in documenting this pandemic. I really have a much greater desire in preventing this pandemic. And while documentation is key, I think we always have to be thinking about what we're doing, all the reports we're putting out, and making sure that it is for action. This is for changing something to better the lives of Alaskans. Like that is the goal. And if that isn't the goal, and every email I put out, every memo, every report, then I've missed the point. And so always asking myself, how is this directly benefiting the health and well-being of Alaskans? And then that really gets into the third part, like putting the patients first. Again, thinking about systems that work for patients instead of patients working for systems. It doesn't help me very much if their doctor sends them to get a test and then that test doesn't get back to their doctor, so their doctor can't act on it, so they don't know what to do, or I never get that, they ever get called from the contact tracers, or the patient never knows. Like that's pointless. Like I might get that data point in the system, but if that doesn't help that patient make individual decisions that help protect their loved ones, their community, so they don't go visit their mom and potentially expose them, or go to their workplace and make people sick, then that data point was useless. So really making systems that work for patients and keeping that goal at the heart of what we do. I had a professor once, who said, Anne, remember that you have to do what's right for the patients and the rest is noise. Whoop. Says I'm muted. Can you hear me? Okay, I'm good again. Thanks, Dave. I like Dave on my computer. I can see him. Thanks. I got fingers. Hi. So thank you. I don't know, something happened with the computer there. So thinking about what's, really the health and well-being of Alaskans and doing what's right for, he said to me, do what's right for the patient. Remember, the rest is noise. Like what is right for Alaskans and what is noise, and really staying super highly focused on what is right for patients. And again, that comment about building systems that are designed that get public input and build in structural approaches to equity. I think we saw this a lot with the vaccine rollout. Early on, IHS was getting some testing. We got some testing. We sent too many tests to some locations and too few to other locations. And when we had multiple people working that weren't in a coordinated way, and you all know this so well as emergency responders, it was challenging to make sure that we all had the right people at the table. And so for that specific example, we said, we got to do this better for vaccine. We don't want vaccine coming into IHS and vaccine coming into the state and sending too much to one area and not enough to another area. And how does that work together? So we built our entire vaccine task force with tribal leadership at every level. And it made it just so much easier. People were at both levels and could really say, this isn't going to make sense here, or this really does make sense here. How are we going to partner this together? And so I think building in structurally to make sure that we have equity and to make sure that we're having the different voices at the table is incredibly important. So just looking forward, thinking about the biggest challenges that we face, I think one is just communication. I think people are done with me. People are done with COVID. People are done with public health in general, and understandably for sure. But how do we keep our eye on the prize? And that's the health and well-being of Alaskans overall. And how do we really pivot? How do we not get stymied in kind of our response, but how do we pivot this and take this momentum? I love the idea of kind of the swarm theory of bees all working together. How do we swarm around healthy and well-being Alaskans moving forward, and how do we pivot? This is going to be a really critical time as we all think about this. So we're thinking a lot about this. How do we make a real push in May to get people vaccinated, and then really pivoting in June to changing our conversation about the health and well-being more uniformly, and take the things that have worked, like our vaccine echoes and our public science echoes, but building in more conversations there. So this is where I would really love your guys' input on how we can think about this differently, and how we can braid funding together. And then what potential does the pandemic have to make us stronger and bring us together? And how can we really recover and heal from kind of this process being able to move into a different place? I've really appreciated many of the tribal leaders who shared with me the 1918 pandemic and the impact that that had on their community, and how it's taken 100 years of that impact. And so how do we take this kind of once in 100-year experience, learn from it, and build a stronger and brighter future together? So with that, I will stop sharing my slides and really want to take any questions. And again, anything's on the table. I learned from you all. And so open it up. And I'm happy to either read through the questions, I see a few in the chat box, or turn it over to you all for moderation.
Thanks for the presentation, Dr. Zink. I can help out with the moderation and the comments here. But I know we all appreciate your time, definitely, as probably the hardest working person in the state. So we appreciate having you here. We have a first question from Martha Wilkins with DCE 10. She's asking, are they in the process of getting a routine approval for the vaccinations versus the emergency use authorization?
That's a really great question. Normally, a full approval requires data amongst multiple age groups. And so that's the biggest thing, looking at any age group that vaccine would be used in. Because the studies were initially done in the people most impacted, either those 16 and above or 18 and above, they submitted that data. Doesn't mean that it doesn't show safety and efficacy. It just means that they haven't looked at all the different age groups. So that's what we're waiting on right now, is the additional trials for children. But when I think about what this functionally means, it's essentially the same for adults. It's just that we don't have that child age group. I do suspect that we will have full authorization of the Moderna and Pfizer vaccines. There are no safety signals that we're seeing right now, despite hundreds of millions of doses seen, besides the ones that we talked about earlier with the very rare anaphylactic and the sore arms. And the early data that we're seeing from childhood vaccines for COVID are looking fantastic for Moderna and Pfizer. So I suspect that we'll have full approval once we have all of those childhood studies done. But I would not change the way you think about these vaccines at this point based on the EUA versus the full authorization based on the data that we're seeing.
All right, thank you. Next question is from Asha Kamroff. How do we convince folks that the vaccine is safe? The percentage of the folks that receive the vaccine versus the side effects outweigh the numbers. I spoke to someone yesterday who said COVID is like the flu. It floored me.
Yeah, and I think it's a great question. And I think when we see national data as well as state data, it reflects your experience that when you look at people ages 18 to 46 or who live in suburban or rural communities, they tend to believe that the vaccine side effects may be as great, if not greater than flu itself, and that, or than COVID itself, and that COVID's not that big of a deal. And I think that can be challenging to overcome. I think helping to put these things in perspective, there was a great little article from Washington Post yesterday that kind of showed the number of people who have gotten vaccinated with J&J versus the side effects. And I think it's easy to kind of focus on these one stories rather than putting it into a larger context. I think it's important to hear people and hear their concerns and say, well, what are the safety concerns that you're worried about? What are the COVID experiences that you've heard about? And sharing what you know about it or trusted sources of information about it. You know, again, I, as a practicing emergency physician, every shift I work, I admit someone to the hospital who says, I just thought this was the flu. I wish someone would have told me. I'm like, I've been saying this for a year. Like, I don't know how else to say it differently. But that is very much a fixed belief. And until you're the one sitting on oxygen, a friend of mine who's a science teacher, she reminds me, she says, and they're just experiential learners. They just have to learn by experience. I say, well, thank you for reminding me of that. I wish we didn't all have to learn from experience. But that's true. We all learn in different ways. And I think sharing people's stories and experiences and remembering that it can be totally true. Someone's asymptomatic or incredibly mild symptomatic, and someone can be very sick and hospitalized. Those are all truths within that and doesn't exclude one from the other. And so this isn't, death coming to each of us, nor is this a totally benign thing. We've had over almost 600,000 people in this country killed from this disease itself. And we just have to, learn from it, take it for what it is, and continue to look forward. So there's a lot of videos on this. There's a lot of descriptions. And I encourage people to look at trusted sources and talk to their healthcare provider.
Thanks. Andy, I see your question, but I feel like it was kind of answered in the last one there. So I'm going to move to Tony Isham. Is Alaska going to sync their travel guidance with the CDC, kind of retesting prior to approval? Question mark.
Yeah, so we're working on it. I see Brian on this call as well. So there's been lots of conversations about just that. It is important that we try to have as uniform messaging as possible. However, sometimes in Alaska, we're either farther ahead or have different strengths and weaknesses than kind of national CDC. So for example, we have more people who are vaccinated in the state than a lot of other states. And so we've kind of moved forward with kind of recommendations when a lot of your community has been vaccinated. We also see travel as a risk for importation, and we have more ability to identify cases early, and we can use our geography to our advantage. I think we have throughout this entire pandemic. So we are working on the travel guidance. But again, I would encourage people to consider taking a test when they're at the airport. Honestly, I came through the airport after a recent one, and I was able to do the screening, tested before my baggage even showed up on it. We're trying to streamline that, make it as quick as possible. That was at like 6 p.m. when I flew in, and I had my negative results before 8 a.m. the next day. So it is really fast turnaround time right now to be able to get those tests back. And again, it's a tool. It's a tool to just make sure that that, and what you did, you didn't, just like, we have tools for screening so that we, have safe travel and the rest of it. This is a tool to minimize our impact. The other thing I would just say about travel is I've thought a lot about marine law. We've had hundreds, if not thousands of years of learning on how diseases are spread and really creating a lot of marine law so that we wouldn't share viruses and bacteria from port to port. But we haven't developed that as a world in our airline space. We have really grown our airline space in a time of amazing vaccination and antibiotics. And I think we need to think about the ways that travel accelerates pandemics in general and what tools we can use to minimize that. So I think we need to learn from our thousands of years of marine experience and not necessarily quarantine ships in the water for 40 days like they did with boats, but use things like testing to be able to minimize the risk of spread of infectious agents moving forward.
Thanks. There's another question from Tony Isham. It's, what is the status of taking advantage of the Apple Google contact tracing application? What is the resistance delay? And have you heard of a push to create a nationwide contact tracing utilizing these options?
Yeah, so we live in a great, diverse democracy, the United States, where every state has a slightly different system. So I am not hearing about a nationwide contact tracing system. Every state has a slightly different way of doing this overall. And really that is in the state's authorities. Regarding the Google Apple, that has changed quite a bit. It is a very hands-off system. I will tell you, like the state has like zero ability to see any of the data, nor does anyone else have any ability to see the data in general. It's very much like your phone can share with someone else who is in that region. People say that they don't want to be tracked by the vaccine. I say, if you don't want to be tracked, don't have a cell phone. There's a lot of information that your cell phones track on a regular basis. Like Google movement, when people say like, well, how much are Alaska's moving? I like Google it and I can like see it because like Google shares that information. Like I don't have any special data to that. That's all kind of out there in the public knowledge and infrastructure space. But right now they are requiring that the health departments kind of sign off on using it, mainly because they just want one to specifically be using it. However, then that requires that our IT and our systems people look into it. And that is not a fast process, I will tell you. So I, for one, wish that Google and Apple would just let people download it and use it if they wanted to use it, because the state isn't even involved in it. So I don't know why they're asking for our permission. So we'll see if that kind of changes. I do think that there's some space in that, but we're kind of in that limbo land of you don't have this data, nor does it have anything to do with you, but you have to approve it. So we're working on that space right now.
Thanks. Next question is from Jody Barthlow. I also apologize if I'm butchering anyone's names. She asked, do you have a timeline in mind when you think we will be able to return to offices and life? June, July, question mark?
Yeah, it all depends on the vaccine, man. It depends on what you and your group are doing. So, I even know like within state government, There have been a whole group of, people said, we're all going to get vaccinated on these dates together because on this date, we'll all be 2 weeks post, and then we're going to start meeting in the office. And they've coordinated as an office to go ahead and do that so that they can all be post-vaccine together in the same office space. So I don't think that's unreasonable now. I mean, the CDC says that, all fully vaccinated people can gather together, without being in large group gatherings, without distancing and without masks on. So if you and your office are all vaccinated, it's a really low risk scenario. The challenge is if you have an office space that's really public facing, or if you have a lot of other people in and out of there and what that looks like. And that's why that also depends on kind of the community vaccine rates and why we're really trying to do everything we can to get communities vaccinated as much as possible to be able to move forward. So that is all up to you all. So if you and your office are vaccinated, then great, have at it. Enjoy the water cooler. You still should be washing your hands for all sorts of other reasons besides COVID. But besides that, I would say go ahead.
All right, thanks. Next question is from, I'm sorry if I'll probably get your name wrong. It's Ukaleasic Okliasic. It's, do you know the number of child COVID cases and long haulers in Alaska?
It's a great question. And a little bit, the answer is no. So on our dashboard, you can see the number of childhood cases. And so I could pull that up and take a look, but that's public information that we share on a regular basis. I will tell you, I was actually just this morning approving our weekly report, and we've seen a real spike in the 0 to 19 cases. I think as people are letting down their guard and the kids can't protect themselves, we're seeing more and more kids being impacted by COVID. Overall, we did put a report out for MIS-C, which is the multi-systemic inflammatory syndrome, the kind of bad inflammatory response that we can see associated with COVID in kids, and the cases that are there. We've had some kids pretty sick, require intubation and a lot of support. We've been fortunate that we haven't had any kids in the state die from COVID-19. Honestly, I feel like we're running out of our luck on that. As long as we continue to have COVID spreading, these kids being exposed, just statistically, it's going to happen here sooner rather than later. And I'd really hate for that to happen. So I think the more we can get protected, we talked a lot about herd immunity at the beginning, but right now when I think of herd immunity, I think of elephants and I think of the kids being in the center and all of these adults are on the outside. And so the way that we protect our kiddos is getting as many adults as we can to be protected. Long haulers is not a reportable condition to us or to the CDC, nor does it have a clear definition. So we don't have any data on that to know exactly what that looks like. We are looking at, within our chronic section, actually building on some additional capacity to do more survey work to understand kind of the impacts of long hauler syndrome here in Alaska. But again, another huge reason for vaccination, you can't get long haulers if you don't get COVID. And so that makes a big difference. And we're starting to see some early data that shows that kind of those long-term side effects can be helped by vaccination. So wanting to see more data on that before we kind of put that claim out there, but seeing some early promising stuff on that.
Next question is from Dave Snyder with the National Tsunami Warning Center. He asks, what metrics are you looking for to feel safer about reopening Alaska, and how will we know when COVID is over for the United States?
Yeah, so thanks, Dave. I'll take that into two different parts. One is I don't have a close sign. So there's nothing closed from a state perspective on this matter, right? We've actually had almost no restrictions for months now. Everything from, pre-procedural testing, that has all moved to the board's recommendations. The travel has been a request, an alert. It's not been a mandate. There have been no business restrictions really since last spring. So I can't really open something that we don't have closed. So that part's hard. And that really then depends on people individually feeling comfortable opening their businesses or what that looks like. And the fastest way to do that is to not have a lot of COVID and have a lot of vaccinated people. And I see this all the time in businesses, people saying, I don't feel comfortable going to X or YZ restaurant because they're not masked or my community isn't highly vaccinated. And so people are choosing to not open businesses because COVID's still around. So if we all choose to be able to get vaccinated and put COVID behind us, then we're going to have people choose to go back to those businesses. So again, that's not a state level, that's really at an individual level. There are municipalities who have local restrictions, and we are really a home rule state, and that is up to local restrictions. But again, when there's not a lot of cases, people open up really quickly. So again, that's the fastest way we get things open. And we are thinking a lot about a lot of people coming in this summer. And so that's why I really want to get people vaccinated overall. So that would be the reopening question. And again, I have the authority to be on a lot of Zooms. I don't really have any other authority. So there's nothing else I can do besides that. The question is, when will it will COVID be over in Alaska? I don't think COVID's ever going to quote unquote be over. Flu is never over. What will happen is that I think this will settle into kind of our baseline rates. And what I think sometimes people don't realize is like with flu, like every year we do a flu campaign to get people vaccinated for flu. And we're like, hey, there's a drive-through at the school and come do it. And these are all the reasons that it will benefit you and others. And some people choose to do it and some people don't. And we in public health, our mission is the health and well-being of Alaskans. So we'll continue to talk about COVID and giving people tools and resources to protect themselves. But it will settle more into kind of a baseline. Our initial goal is always stay the same. I get lots of pushback on this. You've moved the, goalposts. The goal has always been to not overwhelm the healthcare system. And, in November, we came close to that. We were running out of oxygen. We were moving patients from place to place. You all were helping with a lot of that response, and we were pushing the edges pretty darn close to that, but we didn't really fully overwhelm the system. And now that we have a lot more people vaccinated, I think the chances of overwhelming the system are significantly decreased. I think it would be hard to get to that point of overwhelming the healthcare system with how many older people we have vaccinated. But that doesn't mean that people still won't get sick and people won't still be hospitalized and that we don't still encourage people to do what they can to minimize COVID in general overall. But our goal has remained the same, and that's to not overwhelm the healthcare capacity. And I think we're kind of beyond the tipping point of that in many, many ways. But we still want people to be healthy and well, even if we don't overwhelm the healthcare system. I wouldn't tell you to go ahead and hit a tree just because we can take your spleen out and there's a bed available. I'd still tell you it's better not to hit the tree. So don't hit the tree, don't get COVID, wear your helmet, don't get syphilis, and stay healthy. And we'll all be able to do a lot more because of it.
Thanks. Next question from Eric Holloway. It's, how do you feel about COVID passports, or as I like to say, COVID certifications?
Yeah, so great question. I really believe that individuals have a right to their own healthcare. If you go into the emergency department and I do a CT scan of you and I do labs, I didn't make that CBC. Like, that's your blood that you did that CBC on. And you have the right to have that information and to be able to take that to your next doctor's appointment. And we as a healthcare system should make that easy for you. The same's true with vaccine. If you chose to get vaccinated, that's your information and you have a right to share it when how you want. And I want you to have an easy way to be able to share it and to move it forward. But also private businesses can choose on how they want to interact with that. So, some private businesses say that, you have to have a shirt or shoes to come into your business, or say you are a logging company, it's going to be hard to have someone who is in a wheelchair to fell trees. Like, those two just are hard to go together. And so many companies are starting to say it costs us so much to have people getting sick from COVID that we want people to be vaccinated for COVID and what that looks like. So when I think of a passport, I think of like restricting travel movement, and that's really not a state determination. That is a nation to nation determination, moving between different things. I do think that other countries are going to require COVID vaccination to come in, just like yellow fever and other things to move in perspective. But again, the state has no plans for a COVID passport. I will tell you the federal government has no plans for a COVID passport. This is just a tool for you to be able to share your information with others, but other countries may well.
Next up from Sonia McCormick is a comment. I think she's letting folks know that the most recent guidance from OSHA for back to work is out now. Brian Fisher has a link to the coronavirus vaccine outreach for folks that were wondering how to talk to communities or talk to their communities about that. There's a question from Tony Isham. What is the status of breakthrough cases, and is there data of those cases versus what vaccine they received?
Yeah, so great question. So a breakthrough COVID case is someone who has gotten COVID 2 weeks past their second dose, or for the J&J, their first dose. And once they're considered fully vaccinated, they still get COVID. There's a series of reasons that we might identify that. A big part of Alaska is that we might identify it in screening. So again, that travel screening, or maybe they work at a long-term care center, so they're completely asymptomatic, but they get picked up in kind of that screening process. Or they may get picked up because they are symptomatic, because they have a fever or runny nose or chills or other symptoms consistent with COVID, and they test positive. So we do have a series of breakthrough cases in the state of Alaska. We are working on what we call an epi bulletin. These are ways that we summarize kind of different information out. I was actually reviewing it this morning and providing some additional feedback overall on it. So we do see a slight variation between the different vaccine types, but what I actually sent back to them this morning was to compare it to how many of those vaccines we've given in different patient populations to see, is this really disproportionately or not? We expect breakthrough cases. So in the initial vaccine data, a 95% efficacious vaccine meant that still 1 in 20 people could get COVID. It's just that they didn't require hospitalization and they didn't get as sick. So we would expect vaccinated people to still get it, just not nearly as likely, and to be much more likely to be asymptomatic or mildly symptomatic. mean, honestly, I could care less if you all just spread COVID between each other and people are asymptomatic or mildly symptomatic. Like, that doesn't really matter. What I care about is when people are getting so sick that they're requiring hospitalization, they're dying, and they're overwhelming the healthcare system from a big perspective. And so that's really where we see the impacts of this disease. So I think there's this perception that like, I got the vaccine, I'm like, superhuman with this like shield, and I will have like superhuman powers and I'll never get COVID, and maybe I'll be able to run a 6-minute mile. That's not true. Like, it's not actually going to make me run faster, but it will help minimize my risk and chance, but it's not 100%. And that's true with every vaccine. But this is honestly one of the best vaccines that we have of all the vaccines that are out there. Again, flu is somewhere between 40 to 60% efficacious, which saves thousands of lives every year. But again, it's not perfect. So I think it's important to put that in context.
Next question is from Eva Edwards. She asks, for those kids who have gotten COVID, is DHSS seeing repeat cases, especially with kids going back to in-person school?
Yeah, so it's a great question. We definitely are seeing repeat cases. This has been going on long enough that we're seeing people get, COVID multiple times. I haven't seen them pull it down based on age to see repeat cases, if that's happening more likely or less likely with kids rather than adults. But nationwide, we are seeing, initially a lot of our cases were driven by the 20 to 39-year-old age group, but that is starting to move down to that 0 to 19 age group. That group is increasing in our number of cases in our state as well as nationwide. And if you look at a bunch of the CDC messaging in other states, it's really like this is increasingly being driven by children because they can get COVID and they can spread it to others. And they're doing a lot these days. What we see is that mitigation works. And so when they're in a very structured environment like school, where they're distanced, they're masked, they're hand washing, we don't see COVID spread. But that's very different than just kids being kids. And if they are not distanced and they're not masked and they're all sharing water bottles, COVID spreads, surprisingly. And so we do see it really kind of being driven more in those circumstances now. Comp sports, sleepovers, slumber parties, hanging out. Kids are being kids and they are spreading there. So I'm really excited to have childhood vaccine sooner rather than later to help to try to protect more of these kids. And again, everyone 16 and above can get vaccinated now. So those senior athletes, graduation's way safer if you got all those seniors vaccinated. We can start to move down into those age groups now.
All right, so we have about 5 minutes left, so maybe time for 1 or 2 more questions. The next question is from Asha Kamaroff. She says, COVID has affected our cultural practices, and this year was the first time ever that potlatches didn't occur in villages. Once vaccines have been completed, the recommendations is to avoid large gatherings. Potlatches draw a large group of people from all villages. How can villages gauge when it is safe to continue their cultural practices?
Yeah, Alcha, I really appreciate this question. Sometimes I feel like holding off on these cultural practices is sometimes like holding your breath. I mean, this is as important to us as anything else that we do in our society, in our world. I mean, we are social beings, and being connected like that is incredibly important to our health, both our physical health and our mental health and well-being, as well as our cultural values and traditions. I think this is a place where Alaska has been pushing the level of guidance ahead of the CDC because they're looking nationwide overall. Really, when we're thinking about 70% of a community vaccinated, the chances of it being able to spread from person to person significantly decrease. So if you look at like the long-term care facility guidance, they say if 70% of the residents and staff are vaccinated, you can really start to do a lot more visitation safely. I think of vaccination kind of like as taking away pieces of fuel for a fire. And so the more pieces of fuel that are taken away or are wet so they can't burn, the harder it is for that fire to get going. So you can still have a fire in one person or a few people, but it's going to be harder to spread from person to person. So we've been seeing other gathering techniques. So we've seen some villages, do basketball for everyone who's vaccinated and only inviting other villages who are also vaccinated as a way to do it. We've also seen people doing things like vaccinated or testing. Again, we've got more plentiful testing than we ever had before. So, if your community isn't, something like 70% vaccinated, thinking about things like, and you're just really encouraging those who are vaccinated to come or to be able to be tested beforehand. So again, it's not kind of an on or off switch. These are all just tools. So thinking about if your community is ready to have a potlatch and that's kind of this larger gathering, what does your vaccination rate look like? And how can you supplement safety things by distance, outside, masking, or testing to minimize your risk of COVID spreading amongst your community? And the biggest thing is the more you're vaccinated. So I don't know, maybe set a goal for your community, like 70 or 80% of eligible people to be vaccinated and have a potlatch celebration afterwards. So having some sort of a way to to encourage us all to get there, to put the positive connected to what vaccines look like. Because this guy was telling me about how he got vaccinated and the entire room was lined with like barbecues and picnics and people hugging and like all the things we've missed out on. He's like, man, I want to get vaccinated a third time. That was awesome because I've missed out on so much of that. So really thinking about, how can you create a celebratory thing like that in your village, in your community, because it needs to happen, but doing it safely.
Thank you very much, Dr. Zink. And I really hope all of you feel as honored as I do. Having an entire hour of Anne's time to come to talk to all of you is really like gold. I got to tell you, I was complaining last week that I had a day where I had 12 or 14 meetings scheduled in an 8 or 9 hour period. And then I looked at Dr. Zink's calendar and she had 28, between 7 a.m. and 6 p.m. So we really, really appreciate your time, Dr. Zink. Logan said it earlier, and I can testify without a doubt that Anne is probably the hardest working Alaskan in this response. She works so hard that she is usually working with the rest of the Unified Command, sometimes around midnight or 1 o'clock in the morning or 4 o'clock in the morning as we're trying to, work with the East Coast and all that. So Dr. Zink, on behalf of the division, I wanted to thank you for your leadership and your partnership. It couldn't, there are a lot of many positive things that came out of the response to this pandemic, and it was strengthening the relationships we had. And thank God that you joined us as a chief medical officer back in 2019, just in time. I don't know where we would be or what we would have been able to do without you. So thank you very much for your time today, Dr. Zink. And, if we could, virtual hugs for those of us that are vaccinated, and a big round of applause to Dr. Zink for taking the time out this morning to talk to us. I know she's got to run right off to her next set of meetings. So thank you, Ann, and I'll turn it back to you, Logan.